Okay, Mo, and I see some other names. So let's
Yeah.
let's start now. And so as people are logging in and warming up, let me take the opportunity of welcoming everybody, and thanks again for supporting the Machine Learning Special Interest Group. And as always, a call out to folks that are working on things that want to present or speak or present completed projects, half-done projects, or projects in the conceptual phase. We're looking for any and all discussion. And thanks to Saman for suggesting our speaker for this morning, Ashani, who is going to speak on a very topical area. I won't, you've seen the abstract, but of course, anything that's COVID related nowadays is exciting. And so thank you very much for offering to do this. I'm just reading off the bio that was circulated, but you obviously did undergraduate work in Sri Lanka in statistics and have joined the University of Manitoba statistics master's program since 2019. And this work that you're presenting today, you said, is going to be part of your master's thesis, and is some of it has already been accepted for publication. So that's wonderful news, and congratulations. And so with that, I'll turn it over to you.
Thank you. So first of all, I would like to thank the Machine Learning Special Interest Group for giving me this opportunity to talk about my ongoing research work. The title of today's talk is Social Network Analysis and Community Detection on Spread of COVID-19. This is a joint work with my supervisor, Dr. Saman Muthukumarana. Here you will see the outline of today's talk. In the introduction, I will talk about pandemics and how this virus can spread through the travel. In the models and algorithms, I will explain models and algorithms which we used in this study. I will show you the results, and in the results section, I will talk about conclusions. And in the conclusions, I will talk about conclusion. So at the end, all the references which we used for the research work will be shown in the reference section. So first of all, let's go back to past and review the pandemics where people had to maintain the social distance. In the mid-13s, bubonic plague disease was identified from England, and it spread around the Europe and Asia. It was called as Black Death. And to stop this spread, people had to quarantine themselves. Here in this picture, you will see the plague doctor, and they had to wear the mask to prevent from virus while treating the patients. Inside this beak-shaped part, they stored herbs. Also in 1918 and 2003, people had to maintain social distance because of influenza and SARS outbreak, respectively. In the right side of the picture, you can see how patients got treatments inside camps during influenza pandemic. So in general, to control spread of viruses and to flatten the curve, travel is restricted during pandemics. So nowadays we are facing another pandemic, which is called as COVID-19. COVID-19 is the newly identified virus of the family of coronavirus. It was identified in late 2019 from Hubei, China. And in March 2020, it was declared as a global pandemic. This is spread by liquid droplets when an infected person coughs, sneezes, or talk. So to stop the spread of virus, we should maintain social distance and wash our hands. Let's see how this virus, which is found in one country, started to spread around the world. As we know, it takes up to 14 days to start show the symptoms of COVID-19. So once the patient who did not start to show the symptoms start to travel across the countries, it started to spread the virus through those patients. Because of that, by end of April 2020, the virus has spread in more than 150 countries. So in this study, we consider this travel information and developed a social network analysis to understand the spread and community structure of COVID-19 across the world and in Canada. Let's move on to the methodology. For the analysis, we have used 3 data sets. First data set contained data about patients around the world. Second data set contained data about patients in Canada. And the third one has data about countries. When creating models, we need more information about countries. That's why we need this third data set. Travel history information is really important to create these networks, as we are using travel locations to create link between countries. Some patients had more than 1 country names in their travel history. Then we created multiple rows for those patients. Those patients who had no travel history were considered as locally infected. Finally, after cleaning the data, we created new data sets for world and Canada with these 3 variables to create the network. The first variable is source. This is the travel location of the patient and the target country from where that person was identified as a COVID patient, and the weight, number of patients who traveled between those 2 locations. So here I will explain what is social network. A social network is defined as a set of n social actors and a social relationship between each pair of actors. Actually, this actor no need to be a person always. It can be a location, book, building, or any object where we can develop a relationship between them. Here, Yij is equal to 1 if there is a relationship between ith actor and jth actor. Else we value it as 0. By having Yij's for all the nodes, we can create an adjacency matrix, which is called as a social matrix. Social network can be either undirected or directed graph. In the left side graph, we can see any row head in the line between A and B. The only information that we know is A and B have a connection. But in right side graph, line has an arrowhead from A to B. It means there's a connection from A to B. So the data going from A to B. So this is an undirected graph and this is a directed graph. In this study, when developing a network, we have considered countries and provinces of Canada as nodes, and edge or link we created between countries if a patient was traveled between 2 countries. Since we know the direction from where to where the patient has traveled, we created a directed network. Size of these nodes are based on in degree and out degree centralities. I will explain what is in degree and out degree. Before that, we need to understand what is a degree. Degree means number of edges connected to a node. So in degree means number of edges coming towards the node. In the first graph, we can see 2 edges are coming toward C and only 1 for B, and no edges are coming towards A. So here node C has the highest in degree. In contrast, out degree means number of edges going outward from the node. In right side graph, node A, B, and C have 2, 1, and no edges going outward from the nodes respectively. So node A has the highest out degree. Then we considered about developing models to identify the variables which influence to make a link between countries we used in ERGM model. This model will compare the observed network to exponential random graphs. Here you can see the definition. This shows probability of a possible graph. Capital Y shows the adjacency matrix. Simple Y is the possible graphs, and theta is vector of coefficients. GY shows vector of sufficient statistics. In sufficient statistics, we can consider edge level and node level attributes. I will discuss this in later slides. K theta is normalizing constant. Here, I will show how these models are working. ERGM is like logistic regression model for networks. They predict the probability that a pair of nodes in a network will have a link between them. The basic model is fitted using edges. It is like fitting regression model with only an intercept. We can add network attributes also like this. Triangle is a network attribute. So here, this is how we can add a network attribute to our model. Also, we can add node attributes, which explains the nodes. For an example, we can add recovered count of each country node like here and check whether it increased the probability of having a link between these two nodes. For model comparison, we have used AIC and BIC values, and the model with the lowest value is considered as the best model. AIC is Akaike information criterion, and BIC means Bayesian information criterion. AIC is an estimate of the relative distance between the unknown true likelihood function of a data and the fitted likelihood function of the model. So if this distance is lower, which means if the AIC value is smaller, that model is the best model. If we consider BIC, BIC is an estimate of a function of the posterior probability of a model being true. So if the posterior probability is lower, we can say that is the best model. Finally, models were evaluated using goodness of fit and MCMC diagnostics. Then we considered about identifying communities to understand the nature of the spread of COVID-19. Communities can be defined as group of vertices which are having higher probability of being connected to each other than to members of other groups. In social network analysis, there are lots of methods to identify communities, but in our study, we considered directed graphs, and because of that, we had to use algorithms which are developed for directed graphs. So we used following 4 algorithms like Louvain Algorithm, Infomap algorithm, label propagation, and spin glass algorithm. So most of the community detection algorithms are based on modularity. So before going to algorithms, I will explain what is modularity. It measures the strength of a division of a network into groups. Here you can see the equation to measure the modularity. Here I and J should be in the same group. Aij means the adjacency matrix. Ki and Kj shows the degree of node I and J respectively. Simple M shows the number of edges in the graph. So in our study, we considered about directed graphs. So we need to use directed modularity. Here you can see the equation for directed modularity. The only difference we can see between these 2 equations is directed modularity, they consider in degree and out degree instead of the degree. Now, let's move on to the algorithms. The first algorithm that I'm going to discuss is Louvain algorithm. It has 2 phases. First phase is modularity optimization. Here, at the beginning, each node has its own community. When the node I move in from its own community to another community, the modularity can be changed. Using this equation, we can find the difference, that is delta modularity. DIC means the degree of node I in community C. Sum of in shows the number of ingoing edges incident to community C. Also, sum of out shows number of outgoings incident to community C. This process is applied repeatedly and sequentially to all nodes until no modularity increases can occur. Then we go to the second phase. The second phase, we consider nodes in the same group as node and create a new network using these community nodes. And again, go back to modularity optimization and check the delta modularity and go back to community aggregation step. So these steps are carried out until there is no changes in the groups like modules and maximum modularity is achieved. InfoMap algorithm is also repeat the same phases as Louvain algorithm, but here we optimize map equation. This algorithm minimizes the description length of a random walker's movement on a network to find communities. Actually, it tries to compress the movement of a random walker. To understand map equation, first of all, we need to understand these code books. First one is each module or group has a module code book. And these module code books have code words for nodes which are in their modules. Those are derived from the node visit and exit frequency of a random walker. The other code book is index code book. It has code words for modules. Those are derived from the model switch rate of the random walker. So this is the map equation, and it shows that average length of a code is equal to the average length of code words from the index code book and module code book weighted by their rate of use. Here, LM shows the per step description length for module partition M. HQ and HRow shows the average length of code words in index code book and module code book respectively. Q left curved arrow and P right curved arrow shows the rate of use of index code book and module code book respectively. In this algorithm, the main goal is creating clusters in which the random walker stays as long as possible. Label propagation is one of the fastest community detection algorithms. The main assumption of this algorithm is having same class label for nodes near each other. Here you can see the steps of this algorithm. At first, all the nodes have their own community label, and then these labels are propagated through the network. At every iteration of propagation, each node updates its label to the one that the maximum numbers of its neighbors belongs to. This converges when each node has the majority label of its neighbors. Algorithm stops if either convergence or the user-defined maximum number of iteration is achieved. In LPA, a node's label is influenced by another node based on the closeness parameter. Here it shows the equation to calculate the closeness between node I and J. Dij is the Euclidean distance between node I and J. Sigma squared is the parameter to scale proximity. So using Wij values, we can create a transition matrix which is used to perform label propagation. This formula calculates Tij values for the transition matrix. Tij is label transition probabilities propagated from node I to J. The final algorithm is spin-glass algorithm, and it minimizes the Hamiltonian of the network. To understand the Hamiltonian, we first understand the following requirements. Here, we reward internal edges between nodes in the same group and non-links between different groups. Penalize minimizing edges, missing edges between nodes in the same group and edges between different groups. So altogether, we have 4 requirements, and Hamiltonian is given by this formula. These have 4 components for these requirements. Here, sigma I is the spin state or group index of the node I. This delta function is called as Kronecker delta function, and if node I and j are both in the same spin state, it is equal to 1, else 0. This Aij, Bij, Cij, and Dij are weights of the individual contributions respectively. This algorithm tries to minimize the energy of spin glass, with the spin states being the community indices. Here, modularity is rewritten using Hamiltonian as follows. So by minimizing the Hamiltonian, it will minimize modularity. It applies the simulation annealing optimization technique on this model to optimize the modularity, and this simulated annealing is a probabilistic technique which approximates the global optimum of a given function. After identifying the communities based on those 4 algorithms, the results were compared using adjusted rand index and normalized mutual information. These ARI and NMI compare the community results based on topological similarities. ARI value can be between -1 and +1, and +1 indicates a perfect match between the results of 2 algorithms. NMI value can be between 0 to 1, and again, 1 indicates the perfect match. So it is clear that larger the value of ARI and NMI, the community detection results are more similar. Let's move on to results. First, I'm going to discuss the results of the analysis of world dataset. Here, I have plotted the world map and pointed the countries with infected patients. These edges shows which countries patients to where these patients have traveled. So through this in-degree network, we can identify countries with higher in degrees. In cyan color, you can see those countries, mainly China, United Kingdom, Sweden, Spain, and South Korea have higher in degree, which means in these countries, many patients were found who came from other countries. In this out degree network, yellow color nodes have higher out degree. China, Italy, and Iran shows higher out degree. Those countries can be considered as main hubs of COVID-19 spread. When developing ERGM models, we considered following network and node attributes. As network attributes, we used mutual triangle, in degree, and out degree. As node attributes, we considered region, growth rate, density, recovery rate, death rate, number of cases, number of COVID tests in each country. Then 4 models were created. Model 1 using only the edges, Model 2 using network attributes, Model 3 using node attributes, and Model 4 using both node and network attributes. Once we developed the model, we found that only few covariates are significant. So here you can see those remaining significant covariates of all 4 models. Based on this table, model 4 has the lowest AIC and BIC values. So it is considered as the best model. In this figure, you can see the goodness of fit plot for model 4, and it is it shows a good fit for key structural properties of the network. In MCMC diagnosis also show bell-curved density plots, and it indicates the model have converged to a desired state. So this network shows results of InfoMap algorithm. It gives 5 clusters. Around China, there's one group in red color. Around Italy, there's another group in blue color. Around Iran, there's another group in pink color. Those are the highest out degree countries, that China, Iran, and Italy. Also, we have another 2 small groups. In the result of label propagation also, we can see those 3 main clusters, but we have 10 more small clusters, as this algorithm gives 13 clusters altogether. It considered Thailand, France, Singapore, and 6 more countries as separate 6 clusters. Louvain algorithm shows 8 different clusters with 3 large clusters around the main out degree countries and small 5 clusters. Here, South Korea and Germany was considered as separate 2 clusters. Spin class algorithm also shows 5 clusters with 3 large clusters and 2 small clusters. So this table shows the results of pairwise comparison based on the comparison, and based on the table, label propagation and Louvain comparison has the highest ARI and NMI values. Then those algorithm results are the most similar to each other. And here in this figure shows a Sankey plot, which is a graphical comparative illustration of the communities of these 2 algorithms. Through this, we can see the similarity of the communities of Louvain and label propagation algorithm. Green color nodes indicate communities of Louvain, and red color nodes indicate communities of label propagation. Then let's move on to analysis of Canada dataset. Here also I have plotted world map and plotted the travel information of patients. It shows that people from around the world have arrived to Canada. Here I have considered all the states of Canada in degree plot, we can see Ontario, Quebec, and BC have the highest in degree. Since Ontario has the main and the busiest international airport of Canada, it is fair to have highest in degree. And also when considered about out degree plot, we can see that United States has the highest out degree. Hence, we can say many people from United States have traveled to Canada. Same as the world data analysis, we developed models for Canada dataset also. Then model 2 and 4 had the same significant covariates. And because of that, we removed model 4. Based on the table, among these 3 models, model 2 has the lowest AIC and BIC values. Hence, it is considered as the best model. Based on the goodness of fit plot and MCMC diagnosis, we can see that model 2 is a good fit and has converged to a desired state. All the density plots are bell curved. So let's see the results of community detection algorithms. And here you can see the InfoMap results, and it shows all the nodes in one single community. In contrast, label propagation method shows all the nodes in their own communities, except only 2 communities which have 2 nodes. Here we have 62 nodes and 60 clusters. Louvain algorithm gives 10 clusters. A big cluster can be seen around Ontario, which is the highest in degree state. Here, Yukon is considered as a separate community. Also, we can see here Manitoba, Japan, Philippines, and South Korea in one cluster. In spin-class algorithm, it gives 6 clusters. Blue nodes shows the biggest cluster around Ontario. Here also we can see the same cluster, which contain Manitoba, Japan, Philippines, and South Korea. So here we compared those results using ARI and NMI, and spin-glass and Louvain comparison has the highest values. So these two have the most similar outputs. Using Sankey plot, it illustrates the similarity between these two communities also. Here we can see that last two communities of both algorithms have the same nodes. Let's move on to the discussion. We could see that within the first few months of the COVID outbreak, it has spread rapidly around the world. Based on the world analysis, China, Iran, and Italy are the main out-degree hubs, while the United Kingdom, South Korea, Sweden, and Spain are the main in-degree hubs. ERGM models shows that mutuality, in-degree, and out-degree have a significant positive effect on the probability of an edge, while the number of recovered and the number of deaths have a negative effect. Based on Canada analysis, United States is the main out-degree hub, while Ontario, British Columbia, and Quebec are the main in-degree hubs. According to the ERGM models, in-degree and out-degree have significant positive effect on the probability of an edge, while the region has a negative effect. We used R and Python to implement models and algorithms. So the manuscript based on this work is accepted from a journal. Also, we have developed a dynamic graph which shows the spread of COVID-19 around the world. So I will show you that. So this is the world network, and it shows how weekly change this network. Okay, this is how it spread in world network. And if we go to Canada network, this is how it spread. Yeah. So these are the references which we used for the research work. And I would like to express my special thanks of gratitude to my supervisor, Dr. Saman Muthukumarana, for the great guidance and motivation, Department of Statistics, University of Manitoba, staff members of the Department of Statistics, my tax accelerate program funding through my supervisor, and my friends and family for the great support. So thank you.
Well, let me thank you, actually. That was a wonderful presentation, leaving us plenty of time for discussion. Beautiful data visualization. I mean, you have to love the dynamics of that plot. I hope there's a link to that in your paper that's published. But other data visualization, the Sankey plot, thank you for educating me on that. Very, very helpful. So let's open it up for questions and some discussion.
I'll kick off with probably a silly question. In your discussion, you nicely, I was a whole bunch of new ideas in there for me, so thank you. And you did a great job getting to them. But at the end, you talked about the interpreting the models, which is sort of where my brain starts to reconnect with these. How, when you said there was a negative effect of region in I think it was the Canadian model.
Yeah.
And I'm just trying, was region a very, maybe I didn't understand how you incorporated region in your model then.
In my model, region is so this one? Yeah.
So
here,
what does region mean here?
Region means the continent of each country. Okay,
so my stats brain says, so that's got multiple degrees of freedom, right? That's a categorical variable with lots of, and I'm just seeing a single parameter and a single measure of, I'm just, it looks something like if maybe you numbered them 1 to 10 or something, and it was included like a numeric predictor, you know, from coldest continent to hottest continent or something. But I don't know what. Anyways, I wondered about that variable, because I think it's so awesome that you've taken that notion of the networks and how you constructed those, and then you've analyzed those networks here. We didn't record this, did we? Because I need to watch it again slowly and carefully.
Yeah, it is recorded. We have to get Ashani's permission to post it, but it is recorded.
That's great. Thank you.
I'll ask one little detail question from the beginning. The nature of the graph is that you have a source and a target node and an edge between them. And the target was a person is diagnosed with COVID. Is there a time frame diagnosed with COVID after 14 days or something? The person could have contracted COVID in their source country before they came, or they could have contracted it in the country where they were diagnosed.
Yeah, I didn't consider that time. In my data set, it mentioned that it has a travel information column. Through that, I'm getting the target and the source. So if that patient, in that patient's travel information, it contained that, for an example, the patient found in Canada, and the travel in his travel information, it contained USA, then I consider that target is Canada and source is USA. That's how I created the network. I didn't consider about the time in my data set. It didn't mention. Also, I use this data set because currently, because of lots of patients are coming, I couldn't find a better data set with travel information, because I think that now they don't consider about travel information. That's why I at the beginning I told I only consider only this first 3 months of data. From January to March 2020, January, April.
So it might actually help to understand where the data sets 1 and 2 came from.
It's from, I couldn't add that part. I'm sorry about that. Oops. Sorry. So the data set is like this. Oh, I'm not.
We lost your screen sharing.
Yeah. Oh, I think Ashani might have froze up.
Oh, she did indeed. It's the cold. The electrons have stopped. I knew we were getting close.
No, the electrons go faster when it's cold, Bill. They call that superconductivity.
Thank you.
Yeah, well, just while she's coming back on, like you, Rob, yeah, it was interesting to look at the attributes of the characteristics of the data that are used to describe or predict differences amongst the algorithms. Yeah, thinking carefully about the variables that are used there, and what's available too, right?
Mm-hmm.
I love seeing new data structures, right? I want to see 300 patients and 17 variables, and then I know what to do. But to see so many countries or so many different nodes that are related to one another, and the relationship has been described in a sensible way. Now we want to try and model those relationships. That was just so I'm excited. Yeah.
And you could think about other attributes. So that most of them were focused on the characteristics of the pandemic, but there could be other social variables potentially that could be included.
That's
right?
a good point, Lisa. Actually, we were wondering about that. It was very hard to grab that data. To be honest, I tried to connect with actually City of Winnipeg to get local transition data. The real advantage of this kind of work is actually if we have real contact tracing data, we can use this for detecting local clusters, right? Communities of the spread, which will be very useful for decision making in where to lock down rather than just locking down entire province. But unfortunately, this contact tracing data, I don't know whether they do now, but at least they have somewhere sitting, but they are not sharing. But whoever have access, I think we can do something very useful for local as well. Because for example, we know right now, north side is growing, but we don't need to shut down entire province, which will impact the economy of the province. Maybe if we can clearly identify where this is hotspot, maybe that's where we should have strict social distancing and those lockdown measures, but other parts we can open up slowly, which will help to recover the economy, right?
It's almost a hierarchical structure in this. You have a global international pattern, then you have a regional province-based, and now you're talking about drilling down to an individual level.
Exactly. We discussed this in the paper, saying that is the take-home message. We can do this for within locals. That is where this information can be used for decision making in a very meaningful way. Because if you think about, we have these strict measures across the province, which may not be, I mean, it's good to have control, but has a bad impact on the economy, right?
So, Saman, in your data set, so do you have the information just for the entire province, or you actually there have the information, say, for the 5 health of region authority?
If we did not analyze our local data, Carson.
Okay.
What we analyzed was this travel information. For example, people travel history who came to Manitoba around the world. We had that information because it was public, so we used that. But of course, within Manitoba, local travel information with COVID-19 patient is sitting somewhere. I know it is sitting somewhere because they have contact tracing info, right? They still have, I know they keep maintaining, but I don't know who has control over that.
I see. So the second question is, I noticed that in the presentations, the analysis is mostly done for the entire 3 months period, but then during the demo, it seems like you also keep track of the temporal information. Is that correct?
That's a good point. So we use this first 3 months because we had complete, more accurate data. And then we had this temporal analysis you can see clearly through that visualization part. plot how things accelerate very quickly, right? So if we had better control early, we should have control like New Zealand or Australia, etc. But we had a bit of very loose control at the beginning. So once it started spreading, you can see at the end, the plot is exploding because it's hard to keep control. At the beginning, it was very easy, right? It's slowly spreading because the airports were not closed or not the mandatory quarantine in place, etc. I mean, now we are understanding that. But when we analyze this, we analyze all together to understand the spread and the impact of other countries.
I see. But during the not.
So Lisa, Ashani, is she waiting on the lobby or?
There isn't, no, Allison doesn't have the waiting room set up, so she should be able to just connect in.
Oh, what happened to her?
I don't think so.
Yeah, anyway, go, Kasan, you had a question?
Okay, so I think one more question is, well, in your analysis also have you incorporated external information other than just this patient information? For example, when you're talking about this, okay, the in degree and out degree, have you also to consider, say, for example, the effect of the travel bans and all those things, okay, or the decrease of the number of international flights, and then what's the effect when it's actually this?
No, that's another great point. We tried to get whether we can get this flight information. Actually, unfortunately, we cannot have one-to-one matching on that because we need to have that for each airport, etc. Right? We even visited actually Vancouver and Toronto airport, etc. Whether we can even do some data mining from the flight information from the website, but it is, we can't get this match to our data set. So
but you can
these are the great ways going forward. I think whoever, higher level people should pay attention how to have a national, synchronized data collection process for better COVID-19 data analysis. Because if we had that information, that really helps. So, but later on, everything was shut down. So we don't have travel data. So, I mean, we can analyze, hopefully maybe now, perhaps, and see, compare. I mean, that's something we are considering now. This is the first wave, right? First 3 months, maybe we can see how things are happening now at maybe provincial level, because local flights were running still, domestic flights. Domestic travel were in place. Even they only shut down the international travels after that.
Right. Thanks.
Yeah. So actually, we are planning to get into that and continue this work. And like I think other covariates, she didn't present all the details because we considered many other covariates as well, actually, but they did not come as significant. So that could be partly because of incomplete nature of the data. So we did not touch on any because we cannot interpret saying that they are not significant. It is an artifact of the availability of the data. So we did not say anything about that, but we considered many other covariates as well. What is important actually, this is the beauty of social network analysis, because once you build the network attributes may capture all other things happening behind the scene. For example, triangles, stars, because they will somehow capture, right? So we considered those because that way we can keep our academic discussion in place without touching on sensitive interpretation on those covariates on incomplete data. So triangles showed up as a partial significant one, which was very encouraging because of this spread behavior on I think on world data set, not in Canada data set.
Right. Welcome back, Ashani.
Yeah, I'm sorry, I had a power cut.
That's no problem. We understand.
Power cut. Wow.
Yeah.
So everyone was just complimenting you again on the work and many interesting questions and directions this can take. Are there any other questions for Ashani in our remaining minutes?
Yeah, I also can show you the data
sure.
from where I got the data set.
That froze it last time, so hopefully.
Yeah. But I can't share. It's disabled.
Oh, Allison, can you give Ashani screen sharing privileges again? Make her a co-host.
Ashani, there were some very good questions. I tried to answer them while you are away.
Thanks, Allison.
And I think, Carson and Rob had some good points.
Oh.
I probably will talk to you more about that. I'm actually interested in the work.
Yeah, from here I got the data set. It's from John Hopkinson dashboard. Yeah, here we have all the data about even patients. It's updating and yeah.
So this data source is coming from John Hopkins COVID-19 dashboard, Bill.
Okay.
Yes, I see.
Yeah.
Because they had this nice control. I think they still maintain, but not the travel info.
Yeah, it's updated 22 days ago. So they have different versions. They're updating data.
Oh, very nice.
Yeah.
So, I mean, maybe you can show that. I want to touch on, I think Carson asked that question, your dynamic plot, Ashani. So if you can show that, especially Canada one, that really shows the impact of not shutting down, not having control or restrictions on travel early stage, how things got bad. So you can see initially, it is just China, obviously because BC and Ontario has main airports, but then because of not on any restrictions on travel, you see all over the place people were visiting, right, on transit or whatever reason. And then, see, it is 8th week. You can see that because of this 14-day quarantine thing, I think someone asked that question. People may have been traveling, you know.
Yeah.
And now finally, we have sources from all over the world.
So in the graph there, you only just show the nose and the edge, but do you actually have any weight on that? For example, there's how many travelers actually there's from Australia or from Greeks and those information, because then you can have the weighted graph link, right?
Yeah, I used that information at the beginning. In my presentation, I showed that I have 3 columns: source, target, and weight. So weight represent that a number of patients travel between these 2 nodes. Yeah.
It's a weighted network, Carson.
That's right. Okay.
When we analyze, we accounted that actually.
Yeah.
Nice. Ashani, one quick question. It's probably a basic question, but in the community detection algorithms, is it provide a unique convergent solution, or there's concerns about starting conditions? Is there a possibility that this may not converge or uniformly?
Maybe I can answer that, Bill. So the community detection algorithm converge. However, one of the challenge we had, as you notice, the different algorithms detected the communities differently, right? That's why we had this, the ARI index and NMI, to get the feeling about, this is well known in this, I mean, Carson will know, these algorithms are not giving the same detection ability. Because of that, we have to do that through different method, because there may be an artifact of algorithm itself, because they are capable of even inducing communities when there are not. So you can see that's why one algorithm detected all countries to one community, etc., but other one had some agreement. So we compared that, and then that plot nicely showed where we see the maximum. Yeah.
Yes, I like that.
Yeah. So that way we can get a feeling that what should be the best, most appropriate communities detected, right?
Okay, thank you.
But the algorithms are not, they're not sort of strongly stochastic though, right? It's not like there was you don't end up with a different random seed generating a different solution to the clustering. Yeah, okay.
Well, some of the algorithms you picked a random starting node, Rob.
Yeah.
So that results in you know, different solutions.
I'm thinking of, you know, something simple like k-means clustering. You know, it depends on which seeds you start with, which centroids. But it's okay.
Yeah. So I mean, in k-mean clustering, yeah, we need to a priori assign how many clusters we want. But here, one of the advantages we don't do that. So all these network detection algorithms, it has, because that through that matrix Ashani described, that will minimize between community and within community heterogeneity.
Right.
So it converge. There is no issue with convergence, but the issue is, yeah, here. Mm-hmm. So for example, yeah, if you move up, there are a few sensitive parameters, but they make sense in our case. I mean, there is automatic estimation process for that.
Yeah, mainly in these algorithms, they consider modularity, and also in here, without that centroid, they are starting from allocating each node in their own communities, and then start to find those clusters. Here we don't consider centroids actually, since this is network algorithms, mainly about topological factors.
Okay, well, with that, I think we've at the end of our hour, and again, a very stimulating discussion, a very topical, well done presentation, very nice work, Ashani and Saman. I see hand claps from Mo. Yeah, hand claps all around. Well done. Thank you again, and we'll look forward to seeing everybody in a month.
Yeah, thanks again.